I'm Dr. Alan Moseley, and I'm a critical care doctor here in the COVID intensive care unit at Washington Regional Medical Center in Fayetteville. My partners and I have been working and taking care of the sickest patients with COVID for about the past 17 months. A lot of people think that COVID isn't dangerous for children, and one problem is I think we're really dealing with two separate pandemics. Last year, COVID was a problem of the elderly, and this year it's completely different. We're seeing younger people, and what we know is kids often do fine when they get COVID-19, even with the Delta variant, but sometimes they don't. And I don't think we can take risks with our children, even if only a few of them get sick. I have 3 small kids, a 4-year-old, a 7-year-old, and a 9-year-old, and I love them more than anything in the whole world. But right now, they can't be vaccinated. The vaccine is not available to them. And so I'm scared because my kids are vulnerable. And I think that we, as a community, have a responsibility to protect people that are vulnerable. I think all parents, me included, have been very concerned about what's going to happen with COVID when school starts. Well, the good news is we do have an example of that already. The Marion School System, which is a school district in eastern Arkansas, started school in late July. Within 2 weeks, they had 47 cases of COVID among their students. That led to quarantine of more than 900 students. The Marion School District has 4,000 students in their student body. That means that within 2 weeks of starting school, almost a quarter of their students were at home in quarantine. I think it's really difficult for them to do a good job of learning what they need to learn if they're stuck in and out of quarantine. I think it is very likely that something similar would happen here. So regardless of whether your school system requires masks or not, here's something you can do to help protect yourself and help protect your kids. And that is to wear a mask every time you're in public, to encourage vaccination in everyone that you know, and to vaccinate yourself if you haven't been vaccinated yet. If your child is over 12, they need a vaccine, and schedule that appointment as soon as you can. And encourage your kids, all of them, to wear masks at school, even if the school district does not enforce a mandate. We know that if everybody's wearing a mask, then we're as protected as we can be without the vaccine. I hope very soon that vaccines are going to become available for kids under 12. And I plan to give my kids the vaccine as soon as that becomes available. But until that time, masks are our best way forward. And we here at Washington Regional and every doctor I know feel strongly that that is the best way to keep everyone safe, including our kids.